To welcome you all to the inauguration of Karmachintana, a webinar series organized as a part of 15th Suvarna Sambhrama celebrations of Tarnath Government Ayurvedic Medical College and Hospital, Ballari. Tarnath Government Ayurvedic Medical College and Hospital, Ballari has a rich and glorious legacy. This institution was established in 1947 as a private institution under the name Tarnath Ayurvedic Vidyapith and was officially taken over by the government of Karnataka on 21st July 1976. This year marks a significant milestone as an institution proudly completes 50 years of dedicated service under the government of Karnataka. We are initiating a series of academic events beginning with the webinar series Karmachintana. In the coming days, we also plan to organize debates and academic discussions on scientific service and sports medicine, fostering knowledge sharing and academic excellence. To begin today's program, let us center warm welcome to our esteemed dignitaries. I humbly invite our honest guests who are present here to graciously come forward and introduce on the dialogue. Srinivas Prasad sir, Director, ISCR SKD University Belgavi, former President, Board of Ayurveda NKSF, along with Dr. Riyaz Pasha sir, Registrar Evaluation, Rajiv Gandhi University of Health and Sciences, Bengaluru, who have joined us online for today's program. I also extend a warm welcome to all the HODs, teaching faculty, and postgraduate scholars who have gathered here. As we begin this auspicious occasion, let us first use the blessings of the Almighty and invite Dr. Srinidhi to lead us in the prayer. Thank you, Dr. Srinidhi. Now I invite Dr. Vijay Mahadesh Sugar, sir, Associate Professor, Department of Dr. Srinidhi. Now I invite Dr. Vijay Mahadesh Sugar,
Morning, all of you. It is my proud privilege to welcome you all. Special dignitary. This is a great occasion. Sarnath Government Ayurveda Medical College, Bellary, celebrating this year as a celebration. Morning, hence we, the Department of Panchakarma, is a privilege study as well as an initiation by organizing this series. Respected chief guest for today's webinar series, Dr. G. Srinivas Prasad sir. Sir is the director of CSR, Delhi University. Sir is a department School of Ayurveda, included technology, methodology. Sir, I welcome you, sir, from the bottom of my heart. We are deeply honored to have today's inaugurator of this webinar series. My favorite, Dr. Riyaz Pasha sir. Today's guest of honor, Dr. Rajshekar Gange sir. Sir is the backbone of Sarnath Government Ayurveda Medical College, Bellary. Sir is a professor at HOD Department of Ayurveda. Thirdly, I would like to welcome you, sir. I will call upon Dr. Shilpa Shri Madam to hand over now the pay to Dr. Rajshekar. Today's guest of honor, Dr. Panchakarma Gange sir. Sir is the backbone of Sarnath Government Ayurveda Medical College, Bellary. The president of today's program and the most respected principal Manturudi, Dr. Janki S. I'd like to welcome you from bottom of heart. I'd like to call Dr. Santosh Edahali to the Department of Panchakarma. Today's guest of honor, Dr. Panchakarma Gange sir. I would like to welcome our employee, Dr. Janki. I'd like to welcome you from bottom of heart. I'd like to call Dr. Next time, my warm welcome to all officers and HODs from various departments. Sir, and the fellow
Kalyan, Arogyam Dhanam Pada, Yogam Kalyan, Arogyam Dhanam Pada, Jyoti Jyoti Namostute, Jyoti Namaste. Jyoti Parabrahma, Jyoti Janata, Jyoti Parabrahma, Jyoti I now invite Dr. Santosh Secretary, Sir, Professor, and Head, Department of Panchakarma, to provide an overview of today's and the upcoming program.
This chief guest, the man who brought enormous changes in the UG and PG curriculum. University examination section, Dr. Riaz Pasha, sir, president of the function, backbone of this event, Dr. Thank you, Vice Madam. Always supportive and guiding force PGMC, guest of honor of today's inaugural function, Dr. Rajshekar Gange, sir, esteemed speakers, faculty, members of different institutions, HODs of different departments, teaching staff of PGMC, postgraduate scholars, PG students, and all the enthusiastic participants joined us today. University examination section. A very pleasant and warm welcome to everyone for this academic endeavor, Karmachintana webinar series, organized by the Department of Study in Panchakarma, Suvarna Government Ayurvedic College, Bellary, as a part of the prestigious Suvarna Sambhrama celebration. It is indeed a moment of great pride and privilege for our among the various branches of Ayurveda, Panchakarma holds a unique and distinguished position as it represents a comprehensive approach towards purification, rejuvenation, and restoration of physiological balance. Therefore, the contemplation and exploration of these procedures through Karmachintana becomes essential for every Ayurvedic physician and scholar. The objective of this webinar series is to revisit the classical wisdom of our acharyas, critically analyze the principles of Panchakarma, and understand their relevance in present day clinical practice. In an era insights into preventive, promotive, and therapeutic healthcare. In this series, we are honored to have distinguished experts who will enlighten us on various important aspects of Panchakarma. The sessions will cover a wide spectrum of topics, including the fundamental understanding and clinical application of Avarna by Dr. that these sessions will inspire our postgraduate scholars to develop deeper clinical skills, research interest, and greater appreciation towards the vast potential of Panchakarma. On behalf of Department of Peace Studies in Panchakarma, I extend my heartfelt gratitude to all of our respected resource persons for graciously accepting our invitation and sharing their valuable expertise with us. Your presence and guidance will undoubtedly enrich this academic journey. I also acknowledge appreciate the sincere efforts of my department colleagues, Dr. Priya Mugar and Dr. Scholars and department PG scholars whose dedication has made this webinar series possible. With great enthusiasm and a sense of responsibility towards preserving and promoting the heritage of Ayurveda, I welcome you all once again to this intellectual celebration of knowledge and clinical excellence. Let us begin this journey of reflection, learning, and advancement in Panchakarma to Karmachintana. Thank you. Thank you. I also acknowledge appreciate the sincere efforts.
Thank you, sir, for giving a briefing on Karmachintana. To formally introduce the inaugurator of today's program, Dr. Riyan Pasha, sir, I invite Dr. Anupama.
With great enthusiasm and a sense of responsibility towards preserving and promoting the heritage of Ayurveda, I welcome you all once again to this intellectual celebration of knowledge and clinical excellence. Let us begin this journey of reflection, learning, and advancement in Panchakarma to this.
It is my great privilege and honor to introduce our guest, Dr. Riyan Pasha, sir, with digital evaluation at RGHS Bengaluru. Sir is a highly accomplished medical professional, academician, administrator, and public health expert with more than 20 years of dedicated service in the field of community medicine and medical education. Sir completed his MBBS from Basic Medical College, Mysore, MD in Community Medicine from MS Ramana Medical School, and also a postgraduate diploma in Health and Hospital Management from IGNL, and completed General Management for Health Executive Program at the IIM Bangalore. Sir's contribution to subjects include leadership during the COVID-19 pandemic, successful control initiatives, disease surveillance, community-based research, and numerous projects undertaken in collaboration with the Government of Karnataka, Government of India, WHO, and other national and international organizations. Sir has authored and co-authored several scientific publications in reported journals and has guided numerous postgraduate students. In recognition of outstanding service, Sir has been honored with several prestigious awards, including Dr. P. Roy Award, the Kempegowda Award, the COVID-19 Warrior Award, and Young Scientist Award. It is indeed a matter of great pride and privilege to have such an eminent academician, administrator, and health expert with us today. Please join me in extending a warm and heartfelt welcome to Dr. Riaz. Thank you. Thank you, Dr. Anupama. I would now like to invite Dr. Riaz Pasha to share his valuable thoughts on this occasion.
Thank you very much for the kind words. Respected Prasad sir, who is the architect of the newer curriculum for most of the UG and PG curriculum which has come up for Ayurveda. President of today's function, Janki Madam, our senior, most experienced Ganigar sir. Good morning, sir. My colleague and Vishwar Santosh, Pugar, and all the other faculty members who are available there and postgraduate students. I think the Santosh has clearly given an idea about the concept of today's webinar series. What I would like to say is we are standing at a crossroads in the current situation, especially our country, where we are trying to look at the outgoing communicable diseases and upcoming non-communicable diseases. So this is a double burden which the country is facing, where we will also have to take care of the communicable diseases and the non-communicable diseases. And with the non-communicable diseases, lot of things which are coming up, such as diabetes, hypertension, cancers, and other things are related to your lifestyle. So these are all called lifestyle diseases. So in this particular era, when we are facing this sort of an issue, and in our country we are having both the younger population and the older population, and the strength of the older population growing, we need to really look at certain things which is purely patient oriented, and look at a larger holistic approach and a comprehensive healthcare system which is both promotive, curative, preventive, and rehabilitative. So it needs to have all the four components. And many of the times we are still gauging across as looking at the systems as system centric, whether it is Indian system of medicine, whether it is a modern system of medicine, or whether it is anything else which is coming up. But I think it is high time we keep the patient at the center and look at patient centric initiatives, which needs to really look at what is the real function of the health department. Being the health department, unfortunately, we are focusing on diseases and focusing less on health. So our Indian system of medicine, as Dr. Santosh rightly pointed out, we have a rich heritage and rich culture, rich custom, which are evidence-based treatment, which is going on from centuries together. But unfortunately, we are trying to ask evidences for each of those things. And webinars like this will constantly help students to upgrade their knowledge, and with the experts from all across the country sharing their rich experiences in their own fields, the students will be more confident to go ahead and look at what is the best practices available for that particular disease. Not only looking at the disease pattern, but also looking at how to keep people healthy. So nowadays, apart from looking at the physical health, we are also looking at the social and psychological health, which it needs to be looked at through the Indian system of medicine and a comprehensive way of looking at things. So I really congratulate Ganigar sir and team and Saranath Government Ayurvedic Medical College for having this webinar as part of their Golden Jubilee celebrations. And it's a really thought out and apt topic which needs to be taken in by postgraduate studies. We have seen Dr. Santosh being active both in the university, and after he has gone back, he is still being active academically. It's very happy to know that under the guidance of Prasad sir and Janki madam. So I really congratulate all the organizers for having this webinar, and whatever is required, as when sir was there as President Board of Ayurveda in NCASM, what guidelines he has put, we are trying to follow that in letter and spirit in the university. And any such activity which will boost the academic knowledge and improve the clinical practice of the postgraduate students, university is always willing to align towards this. And I'm sure that the deliberations which are happening today, if it comes out as for part of the compendium, where we can try to integrate these teachings into the postgraduate studies, either as a formative assessment or something where the student's skill can be more assessed before he comes out into the actual field, can be really looked at. So I'm looking forward to the wonderful academic feast and the deliberations which go on. I'm sure the organizers, under the guidance of Prasad sir and Madam and Ganigar sir, will surely share the teachings of today and see how we can inculcate few of the teachings which the students have today into the curriculum, so that they become much more better practitioners and really take up the concept of healthcare rather than disease treatment. So thank you very much. I wish all the organizers and the students a very good academic deliberations for the day. Thank you very much for inviting me. Thank you so much. I'm sure the organizers, under the guidance of Prasad sir and Madam and Ganigar sir, will surely share the teachings of today and see how we can inculcate few of the teachings which the students have today into the curriculum, so that they become much more better practitioners and really take up the concept of healthcare rather than disease treatment. So thank you very much. I wish all the organizers and the students a very good academic deliberations for the day. Thank you very much for inviting me. Thank you so much. I'm sure the organizers, under the guidance of Prasad sir and Madam and Ganigar sir, will surely share the teachings of today and see how we can inculcate few of the teachings which the students have today into the curriculum, so that they become much more better practitioners and rather than disease treatment. So thank you very much. I wish all the organizers and students a very good academic deliberations for the day. Thank you very much for inviting me. Thank you. I'm sure the organizers, under the guidance of Sir and Madam and surely there is a good things about it. And see how we can communicate the reason which the students have today into the curriculum so they become a curriculum practitioners and rather than assisting. So thank you very much. I wish all the organizers and students a very good academic deliberations for thank you very much for inviting me. The guidance of Sir and Madam and surely there is a good things about it. And see how we can communicate the reason which the students have today into the curriculum so they become a curriculum practitioners and rather than assisting. Thank you very much. I wish all the organizers a very good academic deliberations for thank you very much for inviting me.
A very good morning to all of you. Am I audible?
The guidance of Sir and Madam and
Is my voice coming? Yes, it's okay. I think they are not audible, I think.
Yeah. There is some issue from the college side with regards to audio. Yes.
Yes, you I could not able to hear. Your speech was okay, clear. Later on it was interrupted.
Yeah. Yes.
A very good morning to all of you. Am I audible? Is my voice coming?
Hello, it is audible, sir.
Yes, audible. Yes, it's okay. I think they
Now
are
you
not
can.
audible.
Now you are audible. Yeah.
Yes.
There is some issue
A very good
from the
morning to all
college
of you.
side with
And
regards to
with,
audio.
Dr. Riyaj Basha,
Yes,
Honorable Registrar, Evaluation of the RGHS, Bangalore, Dr. Rashid Gandige, Dr. HOD, Department of Dravigoda, and Dr. Janaki, the Honorable Principal of the Taranad Ayurveda College, Ballari, and Dr. Santosh and all other professors and all the students, the invitees. I'm very happy to be at this
Hello, it
function
is audible, sir.
as it is a
Yes, audible.
institute is celebrating
Now you
Golden Jubilee
can. Now you are
celebration.
audible.
It's a
Yeah,
very
yes.
happy to know it, very great to know it also.
with
And
regards to
at this
audio.
juncture, we have to remember the great sacrifice, all the great efforts made by even Pandit Taranatji and later on Dr. Ishwar Reddy, who was instrumental in bringing up the Ballari College and also reviving the Panchakarma in this one. Maybe because of the Ishwar Reddy, today Panchakarma is well practiced, widely being practiced there. His efforts we have to remember and be collected. It is very important to know it. And I must appreciate at the same time the administrative setup of the institution and efforts of Dr. Santosh, who has rightly thought of the arranging the webinar series for the important topics. I must appreciate Dr. Basha suggestion also to bring it a compendium. Very good suggestion. I think Dr. Santosh has to exercise for it, and that will be a very useful area also and useful point also. To make it and when the Panchakarma now, when you see, we have it is widely accepted, even public accepted very well, and the Ayurveda professionals also accepted, they employed it very well. And that way, it become globally aware, and everybody is opting Panchakarma, and even medical tourism is happening very well, and Ayurveda is getting boosting up globally. These are the important aspects. Uh, when the few things which I want to say, one is the even Panchakarma itself is a misnomer one way, and though we have several procedures are being done under Panchakarma, even only Panchakarma name itself restricted to 5 procedures. We have more than 120 procedures are there, so we may have to think of how to make the appropriate way of presentation of all the procedures, all the showcasing them also, not only this one. And many of the commercial people has wrongly only depicted with the Shirodhara or massage as a Panchakarma, which is again, it is our duty to give the right impression to the public also, what exactly Panchakarma means and how the Panchakarma is effective, where it can be used. So it is our duty as professionals, we have to misspell the concepts which is having the wrong concept in the public also. And the, as I told, PG, the Panchakarma is well prevalent, with well being practiced. Now we need to go to the one step ahead now, where we have to go to the even tertiary care also. Presently, we are, as Dr. Bhaskar told rightly, lifestyle disorders. So we are able to manage very well, and Ayurveda is very good in that counteract or the give the relief into the lifestyle disorders. And further, we are all now in the comfortable cases we are doing. Now this is the time to extend our expertise to the critical care also, and where the critical patients also to be taken with Panchakarma treatment and to give the relief for them. And as you rightly mentioned, all four types, rehabilitation also, and then the curative also. Like with all types of the management has to be given through Panchakarma and see that benefits are given to the patients. That is very important aspect of that. And then we also have to the levels now, UG and PG. There should be referral system should be there from the basic practitioner to the primary practitioner to the specialist there. So the specialist has to be equipped with the higher skills and higher knowledge. Then only they'll have this one. So we need to have the levels of the higher level of competency at the PG level, so that they can have the expertise cases and critical cases or the tertiary care. They can extend to the Panchakarma through Panchakarma and then get the benefit to the patient. That is very important. And the major aspect is here is we need to reduce the cost of the treatment. Later in the institutions, we never bother it, because institutions are giving all the consumes, etc. We don't bother it. But when the practitioners start a private practice, they can't survive with that higher cost of the treatment. So every HOD or every Panchakarma teacher has to think of where we can bring effective, cost-effective treatments, where we can minimize the consumables, where we can minimize or where we can go for automation. So these points has to thought out, and then we have to reduce, try to reduce the cost. We have to make it cost effective. It is very important so that our practitioners will definitely be able to good practice. That is one aspect. And second one is the standardization. Many times we don't use the proper gadgets, proper items, proper disposables, proper aseptic measures. That is very important to bring standards into the practice. Then only even the public and all sets of public will accept us. Otherwise, the higher level of the public patients, they cannot accept us because of the lack of hygiene, lack of standards, lack of materials. So this is very important there. So cost effectiveness and appropriate materials and consumables to use it is very important there. So this we concentrated at the institutional level, so that the students will be trained and they go back and then they start practicing. So these are all interlinked to each one. That is very important aspect to be looked after by the Panchakarma, the teachers and the departments. And then we have developed the objectivity and rationality in selecting the gadgets and the drug cells. For example, Dept and Suvarna is there. So what is the now present availability? What is the cost of that one? What best can we use it? And then if it require, we can have a GH work on that one, bring it out very simplified. You have the Dept and Suvarna there. So they like the rationality. Recently, I saw one of the article, the playing scheme with the Shingula scheme. The study resulted in the same effectiveness. Now already we have scarcity of the medicine. So using those ones irrelevantly or appropriately or even where we can avoid and we can use the same result also. Likewise, we have to think rationality is very important in the present context. And then what is exactly important there, where to be given there. And then diagnostic precision is very important. And many times patients may bring the big pile of all this one, and then have secondary diagnosis. Again, we have to have the diagnosis. And then clinical assessment is very important there. What exact condition is there? What exactly the dosha or what we call amsham, that is very important. That we have assessment, and then the planning the treatment, and then as per the progress of the disease, again modify the treatment as required. These are things to be inculcated into our practices. And then role of therapist and physician, we have to define and we have to train the students accordingly. Many times it happens in theaters. The students becomes almost PG students become the PROs. They're presenting into the room, making their scheduling, and then they maintain records only. And then therapist will supervising and they're not likewise. The document is part of the treatment anyway. But again, the physician or the PG student must go to the site. For example, the Katibas he has to identify which site they have to make it, mark that one, and then he has to be in between temperature, he has to check it, ask the patient. So this type of medical supervision is required by the PG. Then only they can become a specialist there. Otherwise, they become PGR also. So these are the important aspects which I saw it in my teaching career, and so which are all bringing that one. The Dr. Santosh also would like to take all those ones and implement in the practices. Once again, I compliment Dr. Santosh for taking the very important topics and making the students also very familiar and very advanced, skillful in this context. I wish all the management of the college for the good celebrations of the Golden Jubilee. Wishing you all the best. Thank you all.
Thank you, sir. Thank you.
Important aspects which I saw it in my teaching career, and so which are all bringing that one. The Dr. Santosh also would like to take all those ones and implement in the practices. Once again, I compliment Dr. Santosh for taking the very important topics and making the students also very familiar and very advanced, skillful in this context. I wish all the management of the college for the good celebrations of the Golden Jubilee. Wishing you all the best. Thank you.
Thank you, sir.
The Dr. Santosh also would like to take all those ones and implement in the practices. Once again, I compliment Dr. Santosh for taking the very important topics and making the students also very familiar and very advanced in this context. I wish all the management of the college for the celebrations of the Golden Jubilee. Wishing you all the best. Thank you.
ಒಂದು ಮಹಾವಿದ್ಯಾರ್ಥಿಗಳು ಕೇವಲ ಒಂದು ವಿದ್ಯಾರ್ಥಿಗಳಿಗೆ
speakers all over India, and we have very who are having very good clinical experience. So I request all the students to make the opportunity and participate in slot offer and be
And we are in the stepping stone of the academic excellence and also continued learning. So I request everyone, HODs, faculty members, and especially dear PG scholars to attend these sessions, meaningful sessions, and enrich your knowledge. So with this note, first of all, I want to thank Janaki Madam, our beloved principal, who continuously encourages us and supports us. Thank you, Madam. And I extend my gratitude to the chief guest of the program, Dr. B. Srinivas Prasad Sir, Director, IMCSR, KL University, Belgavi. Sir has accepted our invitation and shared his valuable guidance. Thank you. Thank you very much. And I extend my gratitude for Dr. Diaz Pasha Sir, Register Evaluation, RGHS Bangalore. Sir has given his valuable time to us and motivated us for this session. Thank you very much, sir. And I extend my gratitude to guest of honor, Dr. Rashekar Gandia sir, Professor HOD Department of Raveguna. Sir is like a pillar of our institution. Every time sir encourages us, motivates us, and continuously guides us. Sir, thank you very much. And I
And once in the Mama Shiva, Sister Bambi. Slowly, come and say it, Pop. Can't the funny. Yeah, the same. Yeah, the love. Say it, say it, say it.
Thank you all for your gracious presence and participation. Have a wonderful day ahead. Sorry, sir. Sorry. Sir. Madam,
Thank you.
madam.